This episode of Straight Outta Health IT is brought to you by Welling, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. Welling helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at Welling, we believe when healthcare is connected, everyone thrives. Learn more at wellinkcommunity.com.
Straight out of health IT, the mic stays surgical. Christopher Cunny moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers in the building.
Strip away the enterprise acronyms, and what do you find underneath most healthcare? Small practices, independent clinics, community health centers, specialty groups of 5 to 20 providers trying to serve patients, retain staff, and stay financially viable. And while all drowning in a communication stack that has never been really designed for them. This episode of Straight Outta Health IT, we're going to take seriously. I am your host, Christopher Cunny. And we're going to explore this conversation around the importance of unified communications and the scalability of that for small and mid-sized practices. And we've got somebody on the show, too, that I'm so excited to have that will provide some subject matter expertise on that. But before we do, let me give you just a scenario to think about. Picture it's 8:47 on a Tuesday morning. A patient named Miss Williams. She's 71. And she's managing type 2 diabetes and early hypertension. She calls her primary care clinic and asks for her lab results. She gets a busy signal. She hangs up and calls back. Then she's placed on hold for several minutes. After that, she hangs up, and then she calls back a third time and finally leaves a voicemail, hoping someone will return a call as soon as possible. Unfortunately, 2 days pass before she finally gets somebody to reach back out to her and give her an update on her labs. So during that time period, she's been running high blood pressure. Her medication most likely needed to be adjusted within that time period. And thank goodness that she didn't experience something more serious because she didn't get that phone call in a timely manner. So this isn't just really a patient experience issue. This is really a technology and communications infrastructure problem or gap. And small and mid-sized practices across the country are dealing with this, and this is happening hundreds of times a day. So today I have on the program Damon Covey. He is the general manager of Unified Communications and Collaborations at GoTo. Before leading this portfolio, he was GoTo's senior vice president and head of product. He's got 14 years at Symantec in cybersecurity leadership and a stint as VP of product management at Cox Automotive, and has a clear eye on what's happening and what we should be doing to build the right product for the right customer instead of forcing these enterprise solutions into small practices. So I'm excited to have him here today. He'll unpack what's actually going on, what it means to right-size communications for these types of organizations, and why getting it right could be one of the greatest leverages to innovation available to practices today. Welcome, Damon, to Straight Outta Health IT.
Thank you, Christopher. Glad to be here and love the introduction. Thank you so much.
You're very welcome. Well, let's jump right into this thing. We got a lot to talk about in a short period of time. You know, one of the things I like to do with my guests is just let them take a few minutes. I gave a high-level overview of your resume, but that doesn't really share and tell the real story of who Damon really is. So take a few minutes and take us through your journey and your profession and what led you to doing what you're doing today.
Yeah, thank you, Christopher. Great question. And so if I think back, and I won't give the whole history here, but if you think back to kind of where I started, I've done a number of different things in my career. And in the last 20 years or so, I settled in the product and technology side of things. Before I did that, though, I did everything from you and I talked about earlier, we had some similar coding backgrounds, but I actually did tech support and a lot of customer facing roles with sales and so forth. And so what that gave me was, a very direct insight into, and frankly, empathy for what customers go through every day. And what I wanted to do is bring that into product and technology. I think there's a different way. I think there's a different way that we can, listen to our customers, whether it's, at Symantec, as you mentioned, I was there for a while, or at GoTo, and we can talk about some of the things we're doing there with healthcare. But people deserve solutions that provide actual solutions to their problems, right? And they deserve they deserve UX that goes along with that. They deserve the ability to have those things work for them constantly. That is, I'm a warrior for those things. I love providing those solutions, and I love speaking with customers. And so that's what drives me every day. I go to sleep at night and get up in the morning, because you gave the example earlier about the lady that was, had the healthcare problem. Like, that rings so true to me. And I want to make sure we do whatever we can to enable that for our customers.
Absolutely. Well, we appreciate your leadership in that area. And I gave that scenario because sometimes as technologists, we don't always appreciate the real world implications of these technologies and how they affect individuals on a day-to-day basis. And I wanted to paint that picture that technology can be a benefit or it can be an anchor for organizations and for individuals who are trying to seek quality care. I want to jump into the conversation before we get into the actual solutions themselves, because when they think about healthcare IT and we think about communication transformation, a lot of organizations tend to want to think about Epic and Cerner and think about these large healthcare systems, but that's not where most Americans actually get their care, right? They get their care at the local, clinic, at the local FQHC, at their local primary care facility. Talk to us a little bit about what you see evolving in the delivery of healthcare in our nation today and the challenges that exist as it relates to patients trying to connect with their providers.
Yeah, great question, Christopher. And I think for me, the biggest thing is that as consumers, move and they have new experiences and different options, they want to communicate with their providers the way that they want to communicate with their providers, right? And many times they don't have a lot of time to sit on the phone. They don't have a lot of time to text back and forth. They don't have a lot of time to do those things that take a lot of time. And so we want to make sure that customers have the ability to connect with their practitioners the way they want to, and get pretty immediate responses. And we can talk about some of the ways that we would do that, but those are where some of the gaps exist today.
No, I completely agree. And not to mention, the customer experience, but what about the provider themselves? The staff burnout that's baked right into, these models where the technology isn't right sized for those organizations and they're having to do workarounds in many cases, which can be very taxing on those organizations and the individuals themselves too. Let's kind of diagnose it then. Walk me through what the fragmented communication stack looks like in a typical small practice or small mid-sized practice. And what are some of the symptoms that practice manager is living with every day? Maybe they're just accepting it as a norm, or they're figuring out how to work around it. Give us your insights around that.
Yeah, the good news is they're usually figuring out how to work around it. But as you said, that back-end burnout is real. So typically what you see with a practitioner today is they're usually dealing with a phone system, hopefully a cloud phone system, but maybe an on-prem phone system is built for a time and age that, they're not facing today, right?
Exactly.
And so, having, a telephony system, and then having, you mentioned, Cerner and Athena Health and others, where maybe you've got something that, can communicate, but that's disconnected from the phone system. And so that's a disconnected process right there. And then on the back end as well, I think you called out something really important, which is, how you administer these things, right? How do you actually, if you need to go in there and there's a, day off coming up, or a storm happens, right? Or something of that nature, and you need to make sure you make very simple changes to the system. Most systems were not built with that in mind, right? We're not built with both the practitioner and then the actual patient in mind as well. So those are all symptoms of very fragmented environments. So usually what we see is probably about 5 to 7 different solutions go into creating that experience out there. And again, we have some really smart people that are, that are burning themselves out to create as good of an experience as they can for the patients, but they're still falling short and they're still losing sight of, where that where the communications go, what the integrations look like, things of that nature by having those disparate solutions. And that really shows when customers and patients try to connect into, their practitioners.
No, absolutely, absolutely. And, we touched early on about, these large enterprise, data repositories, EHRs, and other business and financial systems that, have components of communication wired into them, but they aren't fully integrated with these, external phone systems that are really the lifeblood and the true communication conduit to the patient and the clinician themselves. And as we think about, the longitudinal record and the longitudinal patient record and the continuity of care, these communication layers are still very fragmented, right? And they continue to create these gaps. For example, just a patient wanting to call in and reschedule an appointment and not being able to, get timely communication and maybe even some sort of automated tool that can allow them to do that without having to interact with a human being. Talk to me a little bit about that from your perspective as well.
Yes, I think that, that automated portion or that ability, again, to connect how you want, when you want, and create that get appointment or find out what's happening with that is critical. And so, again, having, one tool to bring it together and say, hey, if the person prefers to call, depending on, what their preference is, they can call, they can still do that, or they can, they can text, they can get that information back, they can get reminders, things of that nature. And then have those integrate, on the back end again from a practitioner. I can see if, Betty called in, 5 times, right? I can see if she's, texted me in 5 times. Right now, traditionally, you can't see that, which again leads to the fact that, now in a lot of cases, people are contacting someone back and it's like they've hearing from them for the first time. That's discombobulating for the patient. And no one wants to have to explain themselves, especially when they're not feeling great.
That's correct. Or even something as simple as automatic callback, right? The patient's on hold, giving them an option to say, well, you don't have to sit on hold. We'll call you back when, we're available. And there's an automated callback that takes place so that the patient doesn't have to figure out what's the best time to call back in and try to get that appointment rescheduled or that lab result that they've been waiting on. It's doing that automatically for them. We talked a lot about kind of the emerging technologies, and I grew up in a small rural town, and I can tell you that there's probably a lot of people that still aren't on cloud technologies, right? And so they're still struggling with some of the legacy telecommunication platforms. And so let's talk about kind of the supply side of this, this problem, because there's enterprise grade communication solutions out there. There's unified platforms, cloud-based systems, omni-channel patient engagement tools. Why aren't small practices actually using these right now? What's been the gap or the roadblock for them to fully adopt these technologies?
They're very expensive and they're very complicated to implement, and they themselves are in many cases quite fragmented, right? So having to have a solution that does, people have done a good job of bringing those things together, but having to have, a solution that does, some, call queuing as an example, right, on the backside of things, right? Or, some texting, but having those things separated is tough. And then who do you call when something goes wrong? If we're being frank, for a long time, unified communications providers have actually been incented to make sure that they needed to call, that they needed to actually, make a call into someone to figure out how they get that changed, right? How they get that, particular update made. And, I think there's a better way to give them access to doing that themselves in many cases. Then, of course, provide optionality if they need to have that.
Sure.
But I would say that's been the largest barrier to adoption is just the complexity around setting it up and the complexity around having to manage multiple different systems that do the same thing or similar things. And how do you bring those together? You've either got to find that or someone's really got to, come through and do that integration for you, which means money. There's a lot of cost on the back end for that.
That's right. And to your point, too, many of those practice managers and office managers are, they're not technology savvy. They didn't, go to school or, take on the job to be the IT person or the telecommunications person in their office, but oftentimes they're forced to take on those roles. And so that what I call kind of tier 0 support, that support you get right there at the desk to your point, these technologies aren't, intuitive in nature. That makes it easy for them to troubleshoot their own issues and solve, some of those most likely how-to problems, right? Not necessarily an actual issue with the system, but I don't know how to do something within the system. And because I don't know how to do something within the system, I think the system is broken. And so that's, I think, one of the biggest challenges I've seen as well, too. And as a consultant, I run a consulting firm myself, and I work with practices in health systems all sizes. And I see that the biggest challenge is the cost of support and delivery after the system is installed as well, too, and the adoption of that system as well. Talk to me a little bit from your perspective about how organizations like this small practice that I talked about that's dealing with the patient who can't get connected with the right resources. How's GoTo looking at this and helping to solve a problem like this for a small practice?
A couple things. So I would say the first thing is making sure that there really is one integrated solution that provides all that functionality together, right? And why that matters is not only is it easier to administer, but it's easier to keep track of that patient as they come in and what's happening, right, and what they're doing. The other thing that I think is really important, and I'm sure we'll probably get to talking about AI at some point here, right?
We will.
AI can be daunting. It can be very challenging, right? And so making sure that AI is done in a practical way. We like to really lean into the practical side of things, but then also making sure that that is part of the integrated solution to make sure that, you have other ways to connect with your patients, to connect with your clients that are trying to come in, via other than just the standard ways that they come in, right? And so I think that to me creates that cohesive experience, and then you can see if this person's called in multiple times about this. We can also provide automated ways to do that. The other thing, and again, not to jump the AI shark too much yet, but
let's go there. Yeah,
we actually have the ability within the tool to just, look at and understand the sentiment behind why the person's calling and what's happening, right? And then, very simple rules to say, hey, if this person's calling, they seem frustrated, they seem upset, we can transfer that with intent to someone because we know that that person is actually facing that kind of an issue. And then even, automated options like, AI receptionist options and things of that nature, which will be able to answer a lot of those questions. So it may not completely solve that particular issue you talked about at the front end, but there's certainly a lot of ways that AI can assist with that. But the key is having to be part of the same workflow. Exactly. That's really important.
Right. But I did want to go back because you did touch on a point, and I should have really asked this question first. This term unified communications, right? That's thrown around. And so for that office manager that's listening in on this podcast and they've been pitched by multiple vendors who call them up and trying to sell them a new system, and they throw the term unified communications around and they're like, well, what the hell is that? Help those individuals understand, what does that mean? And how does that, and what's the real value of a unified communication strategy? You've touched on a lot of it just in some of your commentary, but let's kind of wrap that up for that practice manager or that doctor that's trying to figure out, why is this important to me?
Yeah. Unified communications, I mean, it's in the name, right? But it's having a unified solution, a unified place to come in and do. Starts with telephony, if we're candid, right? Still, in fact, we started 20 years ago with Cloud PBX. Telephony have grown up our solution from there.
That's right.
But having the ability to communicate in whatever style you want to, right? And again, texting, if you do social as an example, or web chat, things of that nature, but using texting and telephony, but doing that all inside of one system and making that easier to set up. So having, graphical setup interfaces and graphical, the ability to change those things, not having some, thing, kind of behind a paywall. And then the other thing, which is one of the areas where we're headed, Christopher, is, how do we actually extend that further for healthcare as an example into let's integrate with other solutions out there. You mentioned some of the, HR systems that are in the environment. And we believe that there's an opportunity to provide those integrations that are tailored towards doing that and all be part of that unified communication solution. So the last thing I'd say is it's growing, right? So unified communications definitely started with telephony. It's expanded into things beyond that. But the other thing that's been challenging for customers is you kind of have unified communications, and then you get into contact center and those kinds of things.
That's right.
Traditionally, they're separated, right? And what we've done is, and we've been on a mission to do this for the last almost 10 years, bring all these things together. We don't care what you call it, right? People want the unified communications. They want the ability to manage that, easily. Let's give them that without having to have all of the, PhD degrees and so forth that might come along with, do you understand all these technologies and how they work and interoperate?
No, absolutely. And truly demystifying that for them. And you touched on this a little bit as well, too. One of the biggest pain points you hear from practices is this context, what I call context switching. So every time I have to toggle between a phone system, my EHR, my patient portal, whatever texting tool I'm using, financial system, there's obvious friction that takes place amongst all of that. So there's delays or, maybe even workarounds or just, again, flat out, I'm not going to use that technology. I'm going to find other ways of getting this problem solved, which ultimately impacts the patient. Talk to me about, you did a little bit in your commentary just a few minutes ago about reducing that context switching and how that has real implications on clinicians themselves.
Yes. So a couple of things, right? First of all, you mentioned, this context switching swivel chair, kind of like, which system I'm actually in. So that's why I mentioned things like, the integrations, right? So depending on where you want your workflow to go, you might want front office staff, that's a receptionist as an example, to like sit in a, soft phone, or you might want them to pick up, the hard phone that's out there. But then you want them to be able to see kind of everything that's happening in one unified solution. So there's a way to do that inside of unified communications, but in some cases, the back office staff is not doing that, right? They're actually in the EHR system. And so integrating that back, making sure we update the patient, the record in terms of like what their appointments are and any notes that come through with summaries that come in. And the other thing I would say, what's really important from a unified communication standpoint is to take what's really unstructured data, especially getting about voice, right? That's unstructured data. Turn that into actual structured data that we can then plug in. People can understand what that looks like. And that right there minimizes the need to go back and forth and see what those different things look like. And, did I type this up or did I miss those notes, right? Having those things happen automatically.
That's exciting. Let's drill down. Let's go down that space a little bit more. Is that ambient voice technologies you're talking about? Give us a little more context in terms of what that means, because I could see that as being a real game changer for practices and reducing some of that friction and burden that they have in trying to, translate information from the patient, from the voice conversation they've had, or even the voicemail that they may have left, things of that nature. So give me some thoughts around that.
Yeah. So essentially what the solution will give you the ability to do is take that, again, that unstructured data, right? That conversation you have, understand, was someone upset behind that, right? And, were they happy, et cetera? And then understand what actually transpired automatically in that conversation. Where it makes sense to update the HR, we can do that, right? We can also, do a summary analysis of that information. But what's really powerful is now you've got one place where all that information's at. So you can come in and see quickly, hey, let me analyze what's actually happening with my environment. And so, catching someone that, might have fallen through the cracks, right? Because there's this, in my mind, Christopher, there's this notion of missed calls, but then mishandled calls, right? And they're both problematic, especially for patients. You want to know about what both of those are. So being able to go in there and just, do something as simple as saying, hey, listen for these 5 cues for each one of my calls. And if any one of those 5 things didn't happen, so for example, something as simple as did they announce the practice name, right? To also, did they offer an appointment, right? Or did the person seem upset, right? Those kind of things. And then being able to alert, right? Or create real-time dashboards and real-time sentiment about what's happening with that. That's turning that, that unstructured, again, PBX, right? Private branch exchange, cloud communications data into, actual information that we can then use and do something about that to make that a better experience for our patients.
No, that's powerful. And I can see that being a real game changer in a practice that's, burdened with lack of resources and staff having to play multiple roles in the organization. Anytime you can take some of that cognitive workload off of them, you're making them happier employees, what ultimately translates hopefully to happier patients as well too. I want to delve into a conversation and take it a little bit deeper. My work in this space is focused on technology transformation initiatives, health equity related initiatives. And as I mentioned earlier when we were prepping for this conversation, I'm trying to get my book finished as well. It's called Diagnosing Distrust, why Black and brown people don't trust the U.S. healthcare system and how we can use technology to close the gap. There is a relationship between technology, institutional trust, and health equity. And I think there's some equity dimensions when it comes to communication, being culturally competent and having cultural sensitivity when it comes to communication as well, too, especially when you talk about small practices, right, which are often in underserved communities, FQHCs, rural clinics, community health centers, low-income neighborhoods. There are practices, unfortunately, with sometimes the fewest resources, but the highest communication burden. How does right-sizing communication platforms play in this context of, health equity and cultural competency?
It's a great question. And for me, at least one of the things that I think drives a lot of that is, how do people feel confident communicating, right?
Sure.
What is the style, right? So, again, we live in this crazy world of AI where there's all sorts of optionalities, and there's, AI receptionists that can automatically answer phone calls. But you know what, especially in rural communities, my mother-in-law is almost 90 years old, lives in a, very small community of 5,000 people. Right. I know she wouldn't want to talk to a bot. She doesn't want to talk to anybody outside that, right? And so, I think that's where it comes into having something that comes together, is allowing people to communicate the way they want to. And if you can, understanding that as fast as you can, where and how they want to communicate, and then, allowing them to communicate that way. To me, that is a large part of it, because I think the most disenfranchised you can feel, and the most discombobulated, if I can use that word, you can feel is by being pushed down a communications path that really you don't understand. You don't understand. Right. Are they going to come back to me? Are they going to actually do that? And so, by providing that ability to route, if I using that term, and the ability to, make sure we've got all of those different areas covered, and then customers and patients can choose what they prefer and what they communicate, and starting one way, we can continue that path that way, right? If we want to, try a different way, or give them some optionality to do that, I think that's a really important part of it, because otherwise they will feel disenfranchised. They will feel that there's no other option out there, and that leads to massive dissatisfaction for people wanting to go, do things like diagnose themselves. Again, not to share too much from my mother-in-law, actually went out to the basketball court in her backyard and walked off a heart attack, because she was not getting the communication that she needed from her practitioner, right? And so those are real things that happen, and obviously we want to prevent those from happening.
No, without a doubt. Well, kudos to her for understanding her body and recognizing that she needed to take control and advocate for herself as well, too. And to that point as well, as we talk about this whole cultural competency piece, something as simple as offering multilingual capabilities, right, in your communication. So if I don't, the Spanish is, say, my native language, am I given an option to communicate that way? Are reminders being sent out to me in those native languages? Are interpretation services available for individuals who English may not be their first language as well, too? And I think that's where you really start to, build trust. You start to build patience, adhering to the protocols that, and recommendations that the clinicians provide to them, because they can understand them. In some cases, they may be speaking, and because they're embarrassed to say they don't understand English, they're just shaking their head and saying, yeah, when in fact, they may not truly understand what that clinician is delivering to them. So I do believe that as these technologies continue to evolve, AI being, the most promising one, you will be able to meet people actually where they are, and be able to communicate in a way that's, culturally sensitive to them as well.
I think that's a wonderful point. And I'm glad you mentioned that, because this is one of the, sometimes AI, is a little bewildering, but this is an example where it's beautiful, because it can do some very beautiful things. So for example, our AI receptionist can switch languages with you immediately, right? And so it's actually that's an example where it is a, it's a huge benefit, right? To be able to
Absolutely.
do that and to announce that up front. And then as soon as it detects it, switch the
Hmm.
language, understand that, and then remember that as well as people are
Right.
calling in. Like those are very, very powerful use cases.
Absolutely. And I think it gives instant credibility and it helps that patient feel like they can actually have a very honest and transparent conversation when they can speak in their native tongue as well too. And since you've touched on AI, let's go there for a minute as well too. Let's dive deeper into that conversation. I was just at a major healthcare conference, in Las Vegas this past week, and there were thousands of people there, and quite honestly, thousands of companies, and everyone was talking about AI. Every session, you couldn't get away from the discussion about how AI is impacting healthcare. I'm just curious from your perspective. Is this hype from your perspective from healthcare communications right now? What concerns do you might have? Are these, one of the concerns people are saying these, AI bots are taking away jobs? Give us your thoughts on the application of AI, the good, bad, and ugly of it.
Yeah, great question. And honestly, it's a little bit of all the above. It's
Right.
a little bit of hype. It's a little bit
Yeah.
of reality. It's a little bit of like there are great things like we just talked about that can be
Hmm.
done. What I can unequivocally say is it's here to stay. And what we focus on is the best way for humans to work with AI to
Right.
do a better job, and especially in the case of healthcare for their patients, right? And
Hmm.
so, I think that comes back to, it's a sacred responsibility to take what AI offers, and we
Hmm.
need to stay on top of that, right? So we've got to continue to
Sure.
watch the environment. We've got to continue to watch what's happening out there, but then do things that are very practical. As an example, I mentioned earlier the AI receptionist, right? That can pick
Right.
up calls, it can answer, normal questions. It can also transfer with intent of what's happening with the person, those types of things, up to and including, the ability now to auto schedule
Hmm.
appointments as well, right? So that those are
Right.
very powerful use cases. We'll continue to push down that track, but there's a couple things we want to make sure that it does, right? First of all,
Hmm.
it's got to be easy to set up and use.
That's right.
It's got to be part of their communications workflow,
Right.
the way that it works today. And it's got to work for not just the administrator on the back end. It's got to work for the patient, and it's got to work in a seamless way. So to the extent we can do that, and
Hmm.
the further and further we can integrate with EHR systems in the future and things of that
Right.
nature, we'll continue to do that. But we'll do that in a way where it's integrated together. And the last thing I would say, Christopher, on this one, and we could talk for a long time. I would love to, by the
Yes.
way, on this one is
Absolutely.
I think one of the biggest challenges, if I was a practitioner and I'm seeing everything that's out there, I'm being bombarded daily with point solutions, right? That do, one
Hmm.
or a few specific tasks, and they're
Sure.
really good, right? They're really good at that. I think that's an area where I would caution. I think there's
Yeah.
going to be a lot of consolidation. I don't think there's anything wrong with adopting those solutions today, by the way.
Sure.
But
Sure.
what I would look for, whether it's
Hmm.
us or somebody else, is where are you seeing those solutions being brought in to the existing workflow to make it better for your patients, make it
That's
better
right.
for your folks on the back end, because those technologies are available to all. It's very
Hmm.
tempting to want to bring in 5, 6, 7 tools. Talk to customers all day that
Yes.
have bought all these things or are looking at buying all these things, and now they're saying,
Hmm.
hey, we're actually going to consolidate. So I think that's the
Right.
trend we're going to see a lot of over the next few years. It's consolidation into the platforms that they trust and into the solutions that they trust.
I think you're right as well too, and they're smart to look at a consolidation strategy to have what I call one throat to choke as well too, and that is a partner that understands their entire business and can offer a unified communication strategy that supports that. Ideally, with a platform that can plug into disparate systems, but allow them to manage them in a most cost-effective way. And I think one of the challenges you see, in this industry as well as the implementation risk, to your point, and that's real particular when you talk about small and mid-sized practices. You go to a large healthcare system, they've got a governance structure in place. They've got a vendor management structure in place. The CMIO can raise a flag if the AI deployment is not going well or going sideways. Small practices may not have anybody there who can advocate for them. And so, there's a burden on the vendor to design an AI system that has responsible capabilities associated with it and the appropriate guardrails built into them so that there's real easy escalation to humans. And they built it in a way that there's accountability, through all cycles of the launch, development, and support of that platform as well. We're coming up, I knew this time would go fast. To your point, we could talk hours about, a lot of, and I had probably 5 more questions I wanted to ask you, but I want to be respectful of your time and give you a chance to talk a little bit about your company and, what you guys do and what makes you a competitive differentiator in the marketplace today. And if someone's interested in learning more about your organization, what's the best way for them to reach out to you?
Great. So GoTo Connect, as I mentioned, Christopher, has been around for 20 years. We started as a company called Jive Communications back in the day and have kind of grown up through that. Part of GoTo today. So we do offer, as I mentioned, that one single platform solution that provides all the omni-channel communications you could want, all of the analytics you could want, all those pieces. But the thing that I think is different about us is, number one, we didn't do a number of just different acquisitions and bolted those things on. They're built in to the solution. And that is different, right? The other thing that is, you mentioned, and I won't go into a lot of detail about it, but you mentioned quickly that I did do a stint between Symantec and here at Cox Automotive, right? Absolutely. And so one of the things that we found is as I came in here, I wanted to look at who are our customers. Let's talk about who our customers are, who's actually buying our software. And so, because we were trying to figure out how we were, right? Do we go up market? Do we, or do we stay where we're at? And some of those kind of things. There's a couple things that we are very jealously guarding, right? Sure. Is number one, our customers and who we're special for are small customers, right? And that matters because we build with them in mind. We build with the ease of use in mind. We build with we want to make sure we provide the enterprise grade, but the simplicity, right? And so that's important to that all-in-one unified platform story. And that's really a path less traveled because most customers or most vendors are still, wandering up market, wandering outside of where they're at. But the second part,
and quite honestly, not to interrupt you, but quite honestly, that's why I was interested in having you on the show as well too, because I grew up in a small town. My parents were there. They went to the local doctor there, the small practice, and I saw when I used to take my parents to the doctor some of the challenges they had with technology. And so it was exciting for me to learn and hear that that's your focus, that's your market, and you're building solutions specific for that vertical as well too. So I commend you and your organization for making that commitment to that part of the business as well.
Love it. And it is a road less traveled. There's a reason it's a road less traveled because it's tough to build that, right? It's, that is a closer to a consumer in some cases, type of a use case and those kind of things. The second thing I was going to add to this, and this just comes right along with it, is who are we actually building for within that even, right? So and what we did is we took a look at, as I mentioned, who's buying us today. And what we found is we were particularly, successful in healthcare, in automotive, right? And in, a few other key verticals, education, a few other key verticals outside that as well. So what we set about to do is we said, hey, what is everyone else doing here? And what everyone else is doing is just providing integrations, right? They're like, there's a few integrations to maybe in the HR system here, maybe something here, maybe some HIPAA guidance here, things of that nature. But nobody was doing something that was specific from a solution perspective, right? That had the right nomenclature, had the tailored integrations. And so you could really consolidate, as I mentioned, those 5 solutions into one. So that's what makes us different, right? Is we work with our customers. By the way, there are no ivory towers here. One of the things I love to do is talk to as many customers as I can, because while we're watching the technology, the things that are happening in the clinic every day, the things that are happening in the dealership, in the case of automotive every day, those are the things that are representative of the challenges we need to solve. And so what I've tasked my team to do with, and I think we do really well, is work directly with our customers to understand what those issues are, and we just solve them. That's the key, right? And we do that in a way where we provide that as one unified solution, one unified, they can come in and buy one thing from us, one seat that offers all that functionality. And that has been a difference maker for our customers from an outcome perspective, from a financial perspective, and just a simple, ease of use and delivering service. And so we're not backing off that mission.
Yeah. So you tell me I don't have to buy 50 seats and only use one. I can actually buy one seat and use that one seat and scale as I need to.
You can buy what you need and you can scale, and you can I'll even go one level further with that, is you can actually scale automatically on the fly. You can actually do it yourself by self-servicing what you want, as opposed to having to call someone to do it for you.
Well, now that's a game changer. I hope our audience is picking that up. That doesn't normally happen to people. And so that's a true model that's focused on the type of customers you're dealing with. Well, before we go, I've got what I call my lightning round questions. So it's like a Rorschach test, right?
Okay.
First thing that comes to your mind, I'm just going to go through 2 or 3 of them, given the time frame we have left. But the first one is the biggest myth about unified communications in healthcare.
That it has to be incredibly expensive to be good.
Great answer. Well, one thing small practices should stop doing immediately.
One thing small practices should stop doing immediately is and that's probably what surprised you, is allowing themselves to have disparate systems, one for texting, one for phones, things of that nature.
Yes.
You don't need to do that anymore. Stop doing that, right? Allow yourselves to give that, better experience together. I think that's what they should stop doing immediately.
That sounds good. And then last question, the most underrated feature in modern communications platforms.
The most underrated feature is still remember we started 20 years ago, Christopher?
Right.
Something called the dial plan editor, right? So the visual dial plan editor,
right?
It was invented, 20 years ago, right? And I think ours is unique. I think ours is better than anybody else's, but because it brings all the pieces together. But that is the nervous system, and that's how you set these things up and run with them. It is still the complete, nervous center of everything we do. It's underappreciated a little bit, but it's something that everybody will touch all the time for what they do.
Still very powerful. That's great. Last question, and that is, if someone wanted to find out more about you, your company, your services, what's the best way to get in touch with you guys?
So hit me on LinkedIn, and I never turn any customer away, any partner. So if you want to talk to me, I want to talk to you first off, right? That's number one. And then if you want to learn about our services, I would GoTo.com is a great place to go. You'll see the Connect solutions there, and you'll see specific information for healthcare. And we'd love to assist with you, and we can get in touch with you right away. We can web chat with you over there. We can get you, online demos, things of that nature. But we're super interested in talking to you. And by the way, again, we don't care how big you are, right? If you're bigger and you want to talk to us, that's fine. But we also, if you've got 5 users, let's talk. We have a team that is ready to service you and make sure that you're special.
Well, there you go, folks. We have it. A masterclass on unified communications for small and mid-sized practices. Thank you, Damon Covey, General Manager of Unified Communications and Collaboration at GoTo. Thank you for being on the show today and offering your insights and perspective on how these organizations can scale and right-size with the right technologies to support the patients that they are responsible for on a day-to-day basis. So there you have it, folks. We've got another episode in the bag. If you enjoyed this conversation, please share it with your colleagues, friends, family members, even those who don't really care that much about. We can all benefit from Damon's perspective and expertise in the space of unified communications. If you like the episode, please like, share, and subscribe and follow us on a regular basis. We have amazing guests on this program. And for those who aren't subscribed, I do appreciate your support. And without you, this would not be a possible endeavor for me. So thank you. So that's it. See you on the next side. Take care. God bless. And be straight out of health IT. Peace.
Where the talk stay free. Tune in, turn up. This is where you want to be. Data-driven dreams, they decode the code. Hack the status quo, make the old ways implode. Gusts dropping gems like pockets of gold mines. Healthcare's front lines, redesigned in real time. Honey got the mic, architect of the chatter. Revolutions in the air, healthcare's new chapter. From telehealth to equity, nothing stays unseen. This is more than a podcast, it's the dream machine. The system's pulse is beating to the sound. Voices of change.